We have bone disc, and just follows all the way down our spine here. Excuse me. Out to the floor. There it was. Hey guys, this is Student Dr. Jonathan here with Student Dr. Jesse.
What's up?
Today, we're going to go over passive modalities. And the best passive modality that we have in office is the adjusting. So, while we adjust Jesse here, we're also going to talk about a few other modalities that we have in-house too. So, Jesse, how are you feeling today?
I'm good. Pretty tight. Been a long week, but
yeah.
I'm feeling pretty good.
Yeah? Where are you tight at?
My mid-back.
Mid-back.
Like always, man.
Ooh, it's a tough area for you. Alright, well, let's get that going. Let's see how you're moving a little bit today. So, face me, please. Let's bend towards your left as far as you can go, please. Yeah, that looks pretty good. And then to your right. Okay, a little sticky on that side, I would say. Move better to your left. Cool. And then let's look at your neck. Rotate to your left as far as you can go. To your right. Kosher there. Beautiful. Let's get you on your stomach. Please. Do you want the table up or do you want to
I'm okay to just go straight.
You are a stud.
So what is a passive modality?
Oh, what a great question. So, passive modalities. That's just including anything that's not active by the patient, i.e. like exercise, any rehab that we do, anything that the patient is getting to them done essentially, like the adjustments. So another good modality that we offer in-house is dry needling. Dry needle is based off of trigger point therapy that we use in-house. It's really good stacking with the adjustment because it helps inhibit these tissues surrounding the joints so that they heal properly in a way that can help induce recovery and function more importantly to that area. So big breath in for me. Easy exhale, let your shoulders fall to the floor. Oh boy. Is that alright, Dr. Jesse?
Yes, sir.
Checking your CT junction. That's moving pretty good. So last thing before we end the video, we'll do that special lift that Student Dr. Jesse and I love to do to patients. So
Zipper.
the zipper move, yes. So let's get this guy here. If you want to face me on your side, por favor.
Trademark pending.
And you know what? I'm gonna do a little something new on you today. I don't think I've ever done the kick move.
Oh boy.
Oh boy, all right. So here, hips nice and stacked. Oh, you give me this forearm. This is mine. I'm gonna swoop around. Yeah, you step right here. So big breath in. Easy exhale. Let this fall to the floor. There it was. Other side. What is your favorite passive modality, Student Dr. Jesse?
Oh, man. Well, my favorite is whatever the patient prefers. How
That's
about
a
that?
really good answer. But you don't have one of your own?
To get done on me?
Yeah.
Oh, either laser or the adjustment.
I have to agree with that. There it was. Sorry if you guys couldn't hear that big crack just now, but Jesse, can you vouch for that?
Oh.
Let's see what other modalities that we have in house. So, dry needle, adjusting. We have the classics, electric stim, the e-stim pads. Basically, I use it as like a pain blocker. Excuse me.
Mercy.
So it's really good for people that are really in acute pain, like 1 or 2 days in. Stack it with some ice or heat. It just blocks that pain receptor to the brain, and all they feel is like little buzzing electrodes on their whatever element region of the body that they're getting it done. And then, what else do we have?
We have traction.
Traction's a good one. What is traction's used for?
Traction is used for decompression. It's great for patients suffering entrapments, such as stenosis, etc., dealing with radix.
And a radic, if you guys don't know, he just means any pain that is derived from our spine, from these nerve roots. If you want to look down at that model right here, briefly, we'll do a little education. So this is a dry spine. We have bone, disc, and it just follows all the way down our spine here. And then we have these guys, our little nerve roots that stem out from our spine. And with that, if it's being impinged or encroached, that pinching sensation could elicit some referring pain away from the spine. And that is a true radiculopathy. You could have referred pain will be sclerotic. You could also have sciatica. You could have peripheral nerve entrapments. So usually all from the spine. If we test like the myotomes, dermatomes, all that good stuff here. How do you feel so far?
Great, that was awesome.
Cool. Let's bring you up. Let's do the zipper. Do you want to do it sitting or standing?
Whatever you're more comfortable with, Doc.
You are much taller, so why don't we try the sitting version? So that way people can see us too. So, zipper is really going to focus here, CT junction, and a little upper thoracic here. Basically, if that spine is decompressed, pressed in together, it's going to help separate, get some better movement and more extension. So, arms out like a T for me. I'm going to place my hands here. Oh, you're such a unit. Bring your hands on top of mine. Elbows in, head down. Loosey-goosey. Big breath in.
Whoa!
Whoa!
That was nice.
I wish we had a mic so you guys could hear that.
My man.
And
They
then-
had to have picked some of that up.
I had to. Check out your neck. So, we went over adjusting dry needles, traction, E-stim, ultrasound. Ultrasound is another
Combo.
deep heat modality that we use. In our opinion, it's probably not as good as laser, but still can do the same therapeutic benefit, which is sound waves instead of light therapy. So we have a lot of different variations and options for patients to choose from, because not every patient responds the same with the treatments that we offer in-house. So it's good to have a variation of different options for patients to choose from. Overall, your neck is really good. Maybe a little guy right here. So we're gonna let your head fall into my hand. A little pressure. Big breath. Good.
Very good.
Small guy, but you know.
Very good.
Some movement restored back into that restricted joint. So if you guys have any questions, type them in the comments below.
Ring the bells.
Ring the bells, subscribe, all that good stuff. And anything else you want to mention to our peeps?
No, that was awesome. We like to put the fire out with these passive modalities before we can start building you up with active care, so we can treat conditions at all stages. So look forward to seeing you guys. Let us know if you have any questions, and we'll see you next time.
Beautiful.